Hello, everyone. It's a pleasure to receive you here in Coimbra. My name is Antonio Cunha. I'm part of the staff of Instituto Pedro Nunes. As you know, we have three different vectors. We have work in applied research. We have also a training department, and we have also an incubator and an accelerator. And we are part of Diatomic. We are managing the health component in the digital innovation hub. The session of today is about the needs of the health, and we have a quite simple objective in this session, is to understand how we can influence the research in 10 years, how we can put more needs-driven in research. But I will come back to this later. Before that, let me give you some context about the event, about the Coimbra Sustainability Summit. The idea is to understand how, with technology and partnerships, we could address the 2013 goals of UN, and also how we can, again, with technology and partnerships, achieve the Green Deal objectives. And we are talking always in a 10 years framework. And yes, we have a specific concern when we prepared this summit, somehow to have a balanced ecosystem, researchers, companies, investors, and of course the European Commission, because in fact the European Commission will finance research in the next 10 years, and it's very, very important also to understand somehow the concerns of the European Commission, and also to share with the Commission in our opinion about what could be somehow in the next frameworks. I'm trying to pass this. Okay, we have 4 projects that are supporting this event: Diatomic, BOCAS, Enrich, and AMSEC. All the 4 projects have the same characteristics. All the projects intend to support SMEs in a different ways, but all have the same characteristics. Jumping into the agenda, we have the objective for today. We have different sessions in parallel with different topics. The topic that we will address today here is health, but health with the needs perspective, because we have in the CSS we have 2 different sessions. This focusing the needs, and the second one in the next week that will be more connected with the technology approach. Then we want to influence somehow the next session with this session, because we want to address, or we want to list a different needs that somehow will influence in the next session that will be in the next week, that will be more focused in technology. Jumping into or before that, you have 2 different ways to show interactivity, or to interact with the webinar. You have the Pool Everywhere. If you go to poolev.com and enter the word CSS 2020H, you can see some questions and also answer these questions, and we will see, or all will see, your replies. This is the first way to interact, but you have a second way to interact. You can go to the Q&A session in the or part in the Zoom and put your own questions, because in the panel part we'll read some questions and ask the speakers to reply to these questions. And please interact. Please go to the Q&A and write your questions. That we'll use it in the later stage. Jumping to the or before that, the idea before to jump in the main topic is to understand who we have here. What part of the ecosystem we have represented in this discussion. Then please vote. Where are you in the innovation ecosystem? If you are a university, a research center, startup, industry, healthcare provider, policymaker, others, please vote, because I think this part is important for the speakers and also for me to tune a bit our speech according with what we have in the audience. I think we have quite the university part, the academic part is an important part. We are seeing that here. Research, a part of startups is important also. The providers, policymakers. Let's wait a bit to see others. Centers. We have some industry, goods. And when we are voting, I think I can jump to the topic and explain you and share with you the rationale that we have for this session. The idea is to, of course, to understand how with technology we can address the specific goal, is the third goal of the 2013 UN agenda, that is ensure healthy lives and promote well-being for all at all ages. Then we think that if somehow this goal was part of the agenda in 2014, I think with the days that we are living now, I think this goal will be much more important in the future. But we'll see, in fact, if with our guests, with our speakers, if in fact we have some influence in the future because of the days that we are living. But in fact, our concern is not to debate or to discuss the technologies or the approaches, the measures that we are taking now to address these complicated days. It's more to understand in a 10 years framework what we can do with technology and partnerships to assure this 2013 agenda. Then that's why we invited three different guests that will support or will help us to understand better the last part of the health value chain. We call it PPP, and PPP is not a public-private partnership. In fact, these three words are not so welcome in Portugal. I will not discuss that right now. No, it's provider, patient, and payer. It's the last part of the value chain. That's why we'll discuss more the needs. Then we have these three different perspectives. The patient that could drive or not all the chain, the service provider that in fact is between the payer and the patient, and the payer here could be the state or the insurance companies, could be different organizations, and also the payer that wants, of course, to support only cost benefit services. Then we invited our three wonderful guests. Alexandre Lourenço is hospital manager here in Coimbra University Hospital, and also is the president of the Portuguese Association of Hospital Managers. Is also part of the board of the European Association and others roles. And other roles, and yeah, and we'll discuss a bit this tension between the patient and the payer, how is to be in this middle. Karina, that will be the last presenter, and we'll discuss the patient / the user role. The idea is understand better if in fact the user or the patient drive the value chain or not. And also finally, Ramon, that is, Karina is the Innovation Director of Caritas Diocesana de Coimbra. And the third guest is Ramon, that is Chief Innovation Officer of the Catalan Agency for Innovation. I think Ramon could explain you better, but it's Aquas, and Aquas has a very important influence in the health regional system. In fact, in my opinion, it's a very, very good example how it's possible to establish a strategy somehow to mount over the different hospitals to have like some how do you say, some efficiency over to introduce some efficiency over the system. And yes, I think we can jump to the first presentation or not. No, we have we have a question first. In your opinion, and before to have some information about from our speakers, in your opinion, who is today the driver of the health value chain today? Please be honest. Yeah, I think the patient is winning. I think it's good. We'll see, in fact, if the speakers will agree or not with this view. Yeah, I think we have payer is is competing a lot right now. Yeah, but I think we have the same percentage payer and provider, and patient is with 38%. I think is the winner. Good. Right now, I think we can jump to the first speaker. Ramon, please, the floor is yours.
Okay. Can you hear me?
Very well.
Okay, thank you. First of all, I'd like to thank Antonio Cunha and Instituto Pedro Nunes for this possibility to join this session today. Thank you for this, for giving us this possibility, and Antonio. Second, I'm really very interested in the answer of the last question. Maybe this idea of who is the main driver, maybe it will be possible to add professionals, physicians, nurses, as the main driver for providing value to healthcare systems. And during this 15 minutes presentation, I will give you some ideas related with some lessons learned related with our strategy for fostering innovation in Catalan healthcare system, mainly through the hospitals' activities, and using two different approaches: the generation approach, more push, more related with hospitals' activity, and the demand side approach, more related with the procuring systems and the reimbursement scheme. First of all, let me share with you some take-home message in order to give you 4 big ideas to take home. First of all, a challenging situation, that is, we are in a change of paradigm, and this idea of change of paradigm is extremely related with the change of the dialectics in our sector. And this dialectics is nowadays related with the situation and with the idea of how companies, how universities, how research centers are giving answer to our needs. So the idea of needs versus solution is one of the key. It's one of the key points for talking about future of healthcare sector. Not more procurers will focus in trying to procure what they want. In the next years, we are facing a situation where the procurers, we are payers, are facing answers to the needs, not procuring what they want, but procure what they need. And this is the first important approach, to have a clear differentiation between want and need. First idea. Second idea, it's like a perfect storm. Unfortunately, we have been showing in the last month, never before so much innovation in the funnel of companies, in the portfolio of companies, never before so little money for adopting this innovation from the procurer sides, from the hospital sides. And these situations won't change in the next years. Unfortunately, the innovation in the funnel of companies will increase in the next years. Unfortunately, the money for procure for adopting these innovations won't increase in the next year. So we are experiencing clearly an adoption of innovation problem. It's not a problem of generation of innovation, it's clearly a problem of adopting innovation. In order to solve this situation of difficulties for adopting innovation, this situation of perfect storm, we need to try different approaches. There are no reasons for not trying different approaches. Some years ago, it was nice to do these new approaches. Nowadays, it's a must. It's a must to try to adopt different approaches for solving this adoption of innovation problems. And from our point of view, from our experience in the last years, there are 6 keywords in order to answer this situation. First of all, strategy. Our strategy is supporting what? Is supporting improvement of health outcomes. Is a financial strategy supporting a reduction of budgets. It's supporting a technology strategy. We are trying to adopt innovation. Our strategy, what it's supporting. Second keyword, innovation, as a key answer for solving the main part of our problems at a product level, a process level, service innovation, patient-based innovation, patient experience innovation. Third idea, of course, patient. Fourth keyword, data analytics. Fifth idea related with evaluation. And finally, the reimbursement approach. Let me give you some information related with Catalan healthcare sector. Our healthcare sector is a tax-based healthcare sector. At this moment, we have more or less about 65 hospitals in Catalonia, 12 of them university general hospitals, and more than 380 primary care centers. More or less about 15 years ago, we launched a a program for fostering innovation activities in our hospitals is the right side of the slide, mainly based in creating innovation units in our hospitals, in some cases what we call valorization units, in order to foster transfer activities to companies. We foster the activity in innovation at hospital level, detection of innovation, project management, technology transfer, spin-off companies, changing the legal framework in order to facilitate or relate it with spin-off companies created by doctors, physicians, nurses, engineers in our hospitals, with the idea of taking care of the hospital as a hub of complex service. So with this approach of facing hospital as a hub of complex services, we were clear differentiating what is hospital innovation from the medical innovation. For us, it's most important to foster hospital innovation than medical innovation. So I think that its idea is also important. Hospital innovation, of course, can be related with medical innovation, but it can be also related with process innovation. It could be related with innovation related with ideas, innovation related with patient experience. And fortunately for us, we were successful in a lot of these projects, and we discover left side of the slide that our real problems were not related with generation of innovation, but with adoption of this innovation. We discovered that everybody, everywhere could procure our innovation, but it was impossible for our healthcare systems to procure and to adopt innovation coming from our own hospitals. For example, one of our hospitals promote and launch a new kind of ice creams for patients involved in radiotherapy treatments. Unfortunately, our hospitals could not procure this kind of ice creams. Why? Because our procuring schemes were mainly price-based, not innovation-based. And of course, this kind of ice creams were quite expensive than the traditional ice creams. So it's just a small notice, a very informal notice related with the problems of adopting this innovation. So 5 years ago, we decided to go on promoting the right side of the slide, that is innovation activity in our hospitals, but we also decided to move to the left side of the slide, so promoting different kinds of tools, different kinds of projects, different kinds of process for procurement of innovation in our healthcare systems, or for validation of innovative products and services. So taking to balance these possibilities of not only generating, but also adopting innovation. From our point of view, it exists two kinds of innovations in our healthcare system. First of all, what we call innovation related with unmet needs. This idea of unmet needs is closely related with the daily activity of our professionals. It could be related with a device that doesn't work properly. It could be related with a process that could be improved. This kind of innovation, bottom-up innovation, is extremely related with hospitals, primary care centers, social care centers activity. Other kind of innovation is what we call outcome-driven innovation. It's an innovation that more related with reaching outcomes. These reaching outcomes at healthcare systems level. These outcomes could be defined related with a health strategy of the region, And from our point of view, we are clearly differentiating between overserved and underserved activities in order to identify this kind of outcomes to be reached. Taking care of this situation, we launch a lot of projects, and I will share with you some of our projects in order to try to understand our strategy. Here, I'm showing you a slide with 3 different levels related with the adoption of innovation related with the possibilities of early detection of hospitals-acquired infections. All related was what we call nosocomial infection, that is, infections acquired at hospitals is one of the biggest problems in hospitals. It is one of the first case of death in hospitals, infections acquired in hospital. So we launched a call for tenders for companies, for a spin-off, for asking them to provide us a new kind of solution for early detections of microorganisms in hospitals, but with a non-invasive approach. Nowadays, it doesn't exist, this kind of solution. So some of our hospitals launched this call for tender for these innovative solutions through a pre-commercial public procurement scheme for companies. This is the first level of the slide. Healthcare provider are companies for providing a solution. So please remember the idea of needs solution. Second line of the second level of the slide, once the hospitals, once the companies succeed with this new approach and with these solutions, the payer will be in conditions to ask healthcare provider, to ask hospitals for providing better outcomes, for improving outcomes in all related with hospital-acquired infections. So the payer will change the reimbursement scheme to the hospitals, asking hospitals for improving outcomes related with infections. What will happen in the third level? The hospitals will ask companies for not only for providing this solution for the early detection of these microorganisms through non-invasive approach, but for providing hospitals with a new services for reaching outcomes that the payer asks hospitals for. So the final idea is what began initially as an ask for solution for the companies, finally, after 3 levels, it's a service contract between hospitals and companies. So this idea of from the product first level to finally a new service, I think that it's one of the key approach for the healthcare sector in the next year. So with this approach, what is quite clear is that we have a new situation where healthcare innovation ecosystem is expanding. New agents, new knowledge, new business models, new dissemination models, new tools for funding these activities. For example, Google is providing us with a new algorithm for diagnostic of diabetic retinopathy. Could you imagine the business model for procuring this algorithm? How will the payer reimburse hospitals for procuring an algorithm? It will be an outcome-based payment, an activity-based payment. We are facing this kind of challenges nowadays. So with this new situation, with this new approach, what is quite clear is that we have to align all related with reimbursement schemes, payment models, also business model. What will happen with these new business models related with patient-to-patient activity, for example? How healthcare system will face this situation? Second, we need hospitals, primary care centers, social care centers with an innovation culture. It will be impossible to set up this kind of projects without innovation culture in our organizations. And finally, the main drivers for facing this new situation are related with the value-added approach. That is the idea of from product to service, this idea of servitization, what we call Spotifization of healthcare sector. Second idea, personalization, this patient outcome approach. And third idea, the idea of prevention. The value added will be extremely related with prevention activities and sustainability activities. My final slide related that it will be difficult to implant all these new possibilities. And one of the lessons learned that we are getting after this year's experience are related that it will be impossible to set up this new model in a traditional approach of customer-provider relation. What we are talking is this new approach of value partnerships. So we have to have a clear vision of what value are we looking for in our partners, but at the time, what value are hospitals, primary care centers, social care centers are offering to companies, to startups, and how this partnership value will be connected and will be accessible, will be mutually accessible to other partners of the partnership. And finally, what value will be transferred between partners. So it will be difficult to go on talking about customer-provider relation, and we are moving to a new kind of partnership, more value partnership center. That's all for my part.
Roman, thanks for your intervention. And maybe I could remember that the audience could put questions in Q&A and for Ramon. But before to have some questions, I have some. It's a question or a curiosity, in fact. Because in the daily basis, how you interact with hospitals, how you stimulate somehow this mindset that to be focused not in the clinical practice, but also to be more open for new things, for procurement and so on. How you convince them in this to adopt this new mindset.
Okay, it's a different levels strategy. When we began with our program for fostering innovation in hospitals, what we take some years ago with us. Main part of our hospitals, mainly the general university hospitals, were quite intensive in research activities. We detect that in the hospitals there are a lot of professionals that are not good in research activities, but they are extremely good in all related with innovative activities. So we began to try to detect these, what we call champions at hospitals level, in order to foster, to provide them with a suitable environment for fostering their activity. We also carry out some training activity for managers in order to help them to understand the role of innovation in their institutions. So we worked with the idea of improving the innovation culture in hospitals. Once we began with this program, we succeed in some of the projects. And these quick wins were extremely important for sharing this experience with other hospitals. I'm not sure that in Portugal, but at least in Catalonia, ENVI is a very important engine for promoting activities. So quick wins for other hospitals were a good reasons for other hospitals for promoting activities. If my neighbor is being successful in these activities, why my hospital is not being successful? If my hospital is so good as my neighbor hospital. So this idea of envy was extremely interesting in order to promote some activities. This idea of competition. In our healthcare systems, the funding reimbursement is clearly focusing competition between hospitals. So this idea of being efficient, of being competitive in relation with other hospitals is important. So improving innovation culture in hospitals, providing hospitals with with suitable legal framework for promoting spin-off and startups companies, promoting marketplace between hospitals and companies, promoting educational activities and training activities at executive level in hospitals. And then in the last stages, changing the reimbursement schemes and the procuring systems in order to foster the adoption of innovation. It's a mixed strategy.
Very well, Ramon. I think it was quite concrete, very pragmatic, and yes, I think I understood better now. I think we can pass to our second speaker. Is a second P, is the provider, and somehow is I think is a good glue with your presentation. Yes, we have already some questions in Q&A, but maybe we can address it in the debate part. Alexandre, the floor is yours, please.
Thank you so much, Antonio, for inviting me to participate at the Coimbra Sustainability Summit, and it's a pleasure to be here. I will talk about the provider, in this idea that healthcare is a place for partnerships and technology. Even though you have seen that in Ramon's presentation, there is an obsession from the payer on the provider. So I will talk about this a little bit, what is this kind of relationship, and also in this between payers and patients. First of all, let me just refocus our discussion on the Sustainability Development Goals and these objectives for 2030. Our main goal for healthcare is good health and well-being. And actually there are other goals that are related to it. And you can see partnerships for the goals, the 17, but also other objectives that are, or other goals that are under the SDGs that can be relevant, like for example, clean water and sanitation, that will allow us and our basis to assure good health and well-being, or even the Sustainability Goal 1, that is no poverty, that you know that is quite related with the healthcare needs. But let's focus on the third goal, that is this good health and well-being. And in this sense, we know that to achieve this goal, and there are several sub-goals under it, but mostly we know that we have a problem with preventable diseases. Most of the population is dying prematurely, and we need to develop initiatives, processes that would deal with this kind of problems. And even the goal assumes that we need concerted and sustainable efforts. I really believe that innovation plays a role on it, and that is the purpose also of this this presentation. Anyway, when Antonio asked me to do this presentation, you know that it is quite hard to forecast the future, and mostly the future in 10 years. I don't know if you know the joke, but that you know why God invented economists, and the answer usually is that you need someone that makes more mistakes than the meteo guys. I really believe that this joke can be applied now to epidemiologists for the COVID crisis, that no one knows when is the peak. But anyway, it's quite difficult to forecast the future. And anyway, we know that we can have scenarios, and you need to develop scenarios, and at least to try to redirect our efforts to a better future. Using the technology that we have now in place, I would also ask you, and with this degree of uncertainty, to tell us how it will be the world in one word. You know that you can use this, the pool.f.com -cs S2020H to answer this, and I would like you to engage to know what will be different. For sure, it will be very positive, to be sustainable. This is not, the question is not what we want from the world, it's what it would be, but this is quite sustainable, is quite an interesting answer. But for sure, it will be different and sustainable. A second question that I would like also to destroy them, that's quite negative and uncertain. But let me just focus mostly on population health. How it will be the population health? Are you going to improve the population's health, or it will be better? Well, at least if you comply with the SDG goals, it will be better. More ideas? Will be healthcare more accessible? With more equity? Yeah, better, healthier. We will have, for example, more equity in the health of the population. We have more equal, or we are going to have more differences and more inequity in the healthcare or in health distribution. Improve, live longer, probably. Okay, that's nice, but mostly we have this idea of better. So lots of positive guys in the audience. Let me just pick on this and try also to answer or to refocus all these presentations. How are you going to respond to the challenges of a changing world? And in that sense, we know that at this point we are having growing health inequalities. And if you see the differences between the northern hemisphere and the southern hemisphere, the inequities are growing quite fast. Even we have this differences between the developed world and the low income countries. Actually, even within our societies, we are seeing, even in developed countries like in Europe, we are seeing that the health inequalities are growing. That's a fact. The other fact that I would like also to make a point is on the changing epidemiology. Actually, with the COVID, it changed. Mostly, until the COVID, we thought that infectious diseases was probably a solved problem. We know that they aren't a solved problem. But anyway, we need to continue to deal with the aging factor and multimorbidity that is there, even though we forgot it probably in the last 2 months. But we have this changing epidemiology and the more complex epidemiology with infectious diseases, but with the growing problem of multimorbidity and chronic diseases. Also, we have this emergency of infectious diseases that is quite striking, and it's a problem. We have seen this with COVID-19, but still we are having outbreaks of Ebola or other diseases that can be a problem, or malaria that can be or continue to be a problem even in developed countries. And if you see, for example, tuberculosis and the problem with multi-drug resistance, it continues to be a problem even in developed countries. And with all this, we face multiple economic and political crises that have an impact not only in healthcare needs to increase the poverty, but also in the fiscal space that we have to invest on healthcare. So actually, even if you see that economic crises, they are more often than they used to be, and we are dealing with this economic crisis and political waves. Most of my presentation will be focused on service delivery reforms. That it's probably the points that is more interesting due to our talk today. But in this sense, just to focus on healthcare or on health services, how do you characterize the service delivery today at the current moment? How are they? They are fragmented, they are integrated, they are solving all healthcare needs. Insufficient is a word, yeah. How do you say, how are these health services? Are they integrated enough? Are they user-friendly? Are they safe, for example? Do you feel safe, slow, with length of stay, yeah? And waiting lists? Fragmented, you have in the Q&A, yeah, the chat, slow, insecure. Actually, if you see most of our characterization, we are saying that the system is not what we would expect to be. So actually, we want a system that should be quite different, or you think that should be quite different from what is today. Thank you so much for your participation. But let me ask you, why are we failing? If you think, and if you were saying that it is not enough, it isn't safe, it's slow, why are we failing? Why are we having some problem? Low resources, yeah, more corruption, policy, probably politics, poor, more ideas, low resources, probably, yeah. Yeah, very, very nice ideas. Let me give you an idea or share my vision on this. Actually, the model of care is obsolete. And is obsolete because mostly we continue to have a model of silos. The delivery model is more like a supermarket than a production line. If you see, it's quite unplanned, non-documented, nor managed. It prevails over flexibility, and actually it is increasingly unreliable and safe and prone to error. Also, we must say that even though we are living in a world of science, of data, or of rationality, custom practice and precedent reign over knowledge in healthcare. I don't know if you know, but only at least 1/3 of the medical decisions and what we do within an hospital are evidence-based. Most of our decisions, most of our practices are not evidence-based, even though we are living in a world of rationality and in data. And this is quite interesting to know that a so sophisticated system as healthcare, probably the most sophisticated system of all, one of the most sophisticated industries, the most complex industries, continues to be based on custom practice and precedents. One of the issues is from the payer side that actually the system is based on volume, on quantities. And actually, at some point, we are financing hospitals based on inputs, the number of beds, the number of healthcare professionals. And at some point, we started to funding them for outputs, number of surgeries, number of medical appointments, number of emergency room attendances. But is this correct? Do you want volume or do you want healthcare? My point on this is that if you insist on this model, we are not just only have inputs, outputs, we are going to kaput. And this is also one of the problems of the healthcare system. Another point is the poor coordination. As I've told you before, we live in silos, but actually we continue to fail on communicating between these different silos. We have a failure to share information between these silos. We fail on these interfaces. We have duplication of efforts. We increase our level of errors, delays, and poor quality of care. If you compare the healthcare system with the banking sector, for example, you can go online and see all your banking documents or your banking information. If you go to each of the banks, you are going to get same information. Even though different banks, we can have information from other banks in a small apps that we have on the phone. Actually, in healthcare, we in each point of care, we are going to tell our medical history again. We don't have share information. So it's quite, or the lag between healthcare and other industries is quite hard. At some point also we have resistance to innovation. And actually healthcare, it's quite resistant to innovation, mostly because we are focused on the processes and we are not focused on the outcomes. I don't know if you know this bridge. It's a bridge in Honduras that was built in 1996. Actually, it was a very, very very interesting piece of architecture and engineering, and it was built to endure high level of storms and cyclones. But in 1998, a very, very big storm changed the system or changed the river, and now the bridge is like this. And if you see the bridge, it's completely different. See the river pass aside the river. I think this is a very, very interesting point if you think on the healthcare system. At some point, the population change and the needs of the population are quite different from what we are offering, even though we have a very complex system. But it's quite crystallized, and it did not evolve from the last years following patient needs. I think Karina is going to talk about this during her presentation, but actually the healthcare system didn't change and it's not flexible enough to follow patient and population needs. So I think I don't have too more time, but let me think what it will be or what we need to do in 2030. Most of all, we need to build this people-centered health systems, introducing new care settings for managing these transitions between silos, merging existing providers and care settings and reshaping the model of care. Also incentivize different parts of the system to work together more efficiently, not only between levels of care, but also between healthcare and social providers and municipalities and other partners, and also helping people with more complex needs navigate the existing system better. Within these points, what is the role of technology? If you want to have this more people-centered system, what would be the role of technology? Improvements, okay. Is it a driver technology? It is a tool, an enabler, yeah. A tool. I totally follow that. An enabler and a tool, a facilitator. Yeah, that's it. I really believe that technology is a tool, as you can see in this slide. actually it is a tool, but not the driver of the change. The driver of the change should be the system itself. Even though the technology can lever existing or lever the change, and the introduction of technology can lever this this change. But considering that it would be always following a population and patient needs, not the opposite. So when you are thinking about developing technologies, please bear in mind that you really need to speak with patients and healthcare professionals, because at some point and sometimes we are approached by, for example, from startups, with ideas that are not that are nice ideas, but they are not applicable and they are not even needed on the healthcare sector. So or healthcare sector. So in this sense, we really need to think on the interface and how technology can improve the healthcare system, but mostly based on population and providers' specific needs. Just to finalize, this Uber message for healthcare is quite clear. Providers have three choices. One is to ignore innovators and hope for the best. The other choice is call for increasing regulation to make it harder for innovators to enter the market. And you can see this in several areas. Actually, healthcare is one of the areas that is more regulated. And also, and I really believe in this last, that is compete on quality and efficiency, because disruptive thought that may be. So in our idea, technology, like hospitals, are not the center of the health system. The center of health system are the patients and the communities. And all our capacity, and even if you know, and if you see one of the messages from this COVID-19 pandemic is that actually everyone is dependent and interdependent. So in this sense, we need technology also to help us build better communities, not only increasing individual health, but community health, and to influence how communities behave. So we are welcome to this brave new world, and I hope that I have give you some food for thoughts, and that I believe that Karina will follow after me. Thank you so much.
Thanks, Alexandre, for your very detailed presentation. I think it was important, and it's easy to see what we need to change somehow to improve the system in near future. All in this model that is obsolete, what we need to have, what we need to improve in the future. I think we have some questions already in Q&A, but we are running out of time. Then maybe we will pass the word to Karina, and we come back to the questions in the last part of the session. Karina, please. You are muted.
Sorry, yes, sorry, already noticed. So good morning. First of all, thank you for the invitation to be here. I'm very glad to be having this discussion. I hope that everyone as well is able to engage in the short questions that we are going to put, and also at the end, because of course this is the new reality and we have to do webinars instead of face-to-face discussions, but I still hope we can interact. So the first two colleagues presented very nice things, and Alexandre for sure gave me some nice cues to act on. I'm not being able to change. Oh, okay, now it's changing. So I brought this because probably I'm too old already, but when I was maybe 10 years old, we thought that the future in 1999 would be amazing because we could teletransport, we lived in the space, there were a lot of other challenges, but apparently it was very easy to do some things. And for example, if you were ill, you had nanorobots treating you, or strange machines that could make you heal very easily. Strangely, we are in 2020. And in 2020, this is not the right photo because I never took it, but in my grandmother's small village, when the doctor comes for primary care, they still have to go during the night to be able to be in the queue in order to ask for a prescription. And this still happens in some places. Gladly not in Coimbra, where I live, for example, but the truth is that in some other regions, the healthcare provision is still so far away from what we would be expecting when we were seeing science fiction series in 1985 or around that date. So the first question would be, how on earth can we have so many nice technologies already and still be dealing with so many difficult things to solve? How do we have so much high tech being developed? How can we be making our lives, for example, through computers now, and better or worse dealing with the difficulties we have, and still have so many things missing in the most primary part? So why indeed are we having this gap between development and in this case technologies, because this was a bit as far as I understood also the discussion here. How can we not bring all the good things that we develop and implement them at scale? Not just for one or two people, not just in the big private hospitals, but why can we not do it for everyone? This was probably the first big thing that we need to ask when we start this discussion. And I would like to resent it a little bit. And in the beginning, we discussed the patient perspective, but I honestly prefer to call it the citizen perspective, because healthcare should not only exist for the patients, and with the patients I say when we are ill or when we need to take care of some problem in health, but instead it should be something that oversees all your life, even in prevention. And prevention for sure could be a much bigger investment for health, and therefore every time in your life as a citizen, healthcare should be there and not just when you are ill. So this is a bit how I would like to phrase it, if it is possible, and talk about the citizen view. And of course, because of my professional connection to a social care provider, I would like to discuss a little bit here, not only the perspective of me as an individual citizen, but also, and following a bit on the cue by Alexandre, on the way that healthcare is seen by, for example, the people that we support at Caritas. So very briefly, and just making this context, as I was saying, I work for an NGO, which provides many different types of services, but in some of the ones you can see here, especially the services provided to older adults and to people in situations of vulnerability, in these cases, for sure, I can endorse what was said before, that healthcare does not arrive to everyone at the same pace, and for sure not in the same way. So as I was saying, I would like to discuss this not only on my personal perspective, but also as a proxy of all the people that we support every day, and that for many reasons usually don't have the healthcare that they would like to have at this time. So what we would like to ask is, if you consider at this point, and this is a question for the supply side, that we have a lot of industry here, at least startups, and you think about having a technical solution for healthcare. How did you get there? Did you talk to someone, or it was coming from your own idea? This was interesting for us to understand, also to move on with the conversation ahead. Okay, we are good, getting very good. Apparently, some of the at least the people who are for sure in the summit are already used to discuss things with the users. Okay, this is nice news. The truth is that if this happens, then we need to understand if we are responding to the real needs and wishes of people. And with this, I don't mean to say that, for example, for all of those who work in companies and provide any kind of support to healthcare, that they should individually or subjectively try to answer to needs and wishes, because, well, needs and wishes are a very broad subject, but that we need to understand not what the service can provide, but instead what we would need to provide if we wanted to make a world where we can reach 2030 with more health and well-being. So in truth, I think that we are still not in 1999, because for many years we failed to respond to the real needs and wishes of people. And in fact, Alexandra, I think, went through this before. The truth is that we are a social care organization in Caritas, and we participate in a lot of different projects, either technical related, innovation related, or even more connected to social care and inclusion, for example, poverty, etc. And we do this because we completely acknowledge that we needed to move on from the usual health and care system for the usual social care services, because the truth is that people evolved, and at a certain point it is for sure like the bridge in Honduras that Alexandra shows. We cannot stay in the same bridge even if the river doesn't pass there. So for some time now, we have been trying to be and do what our supply side here in the summit discussed in the poll. We are those that are available to discuss, that are available to provide some input to the technical partners, to the healthcare providers, even to the payers, and to let them know what people feel when they experiment certain things, if this could be useful for their lives or not, and then in what way that could be absorbed by the system to be able to be used. These are just some examples of things we have been pushing through with our older adults, our users in different services, and we try to understand in what way they feel it can improve their lives, or if it cannot anyway. In fact, we have been having good experiments in many ways. Some of them are still immature. For example, the case of the robots, the users love them, but we still need to do a lot of work to have them in their daily lives. But other things are quite simple and they could be implemented. However, this is where we reach. We made this process. Apparently, we can already talk to the different organizations. The supply side is talking to us and is trying to develop solutions with us, with the users, with the citizens, with the patients. But still, we are going back to the initial slides, and we still have people who cannot access the most simple things in life without having a big effort, or without at least not having the best delivery of healthcare. So the biggest question would be, why are innovative solutions not implemented at scale? This is what we would like to know at this point. Why do you think that there is such a big gap between nice things that we do? Many of you have products, we have needs, everyone here would like things to evolve. Why doesn't the system get these new innovative things and just put them in the current and normal services? We saw this before when we were talking about resources. And this is for me a very tricky thing. Do you really think we lack money, or do you think we should understand how to use the money? Because I see a lot of interesting words here. We have governance, politics, and the market, so things more high level, but then we have so many small interesting things here, like heavy schemes, regulations, validation, uncertainty. Uncertainty is something that was here from the beginning, and that probably is something we would need to debate to understand. But this for sure is a very nice cloud to be broken, and I hope that we can do that face to face very soon, because there is a lot of information here that I think is very nice to know. I'm taking a print, and maybe we can take this back for the discussion at the end. So the truth is that we try to understand in several different groups we participate in many networks, why were we not implementing things at scale in different countries? Because it could be a Portuguese thing, or it could be a regional thing. So let's try to understand if this works better somewhere. In 2018, Caritas, with a lot of different partners, around 170, initiated a thematic network to discuss how we could put together healthcare, social care, ICT, and the built environment, because this is something we haven't discussed much, but that we also think it's very important, either the housing or the outdoor environment. And how could these areas all talk together and start having integrated policy and funding? And this goes again a little bit to what Alexandre meant, more specifically on healthcare, but that I here would like to expand to even other areas of knowledge and policy. That actually many times the problem is that we treat everything separately. And it would be very important to have integrated policy for healthcare, social care, ICTs, construction, and so many other areas where things would have all the needed building blocks in order to be implemented and not thought of completely scattered. This also goes to us, to all the citizens, because for sure we can understand everything that was bad. And I was highlighting, I admit it, for a long time what was bad. But at the same time, the truth is that we don't participate in democracy as we should. Many times we don't take that much good care of us. And for sure there is more that we could do as a community to make sure that a policy is not made by others, but is also made by us. So I wouldn't like to finish this without saying that citizen empowerment is also made of duties and not only of rights. We should indeed be making more to make sure that the healthcare system is changed. All the systems that we see as bad can be adjusted, and that we can reach 2030 maybe in a better shape. So I would say, as a citizen, what is your wish list for health in 2030? If you can say it in one word, how would you like to have it? And I would like to have a really nice and big wish list, because this should guide us for the next 10 years to make sure that we get there, but that we also contributed something to get there. So I urge you to make one print out of this wish list in some minutes and take it home and see if you can at least make one action where you contributed to have one of these in your lives. And maybe if we all do, we can for sure influence the system enough. Well, that's very, very nice. I see so many things, not only going to specific health, but also in the surroundings of that, having clean air, having preventive measures, having a lot of information. Information is for sure one of the most needed things, clear and good information, and also having nice pathways and care coordination. So I hope this can at least inspire a little bit the rest of the day for you, and I hope we can together do something else to make sure that we reach 2030 with some of these in our hands. Thank you so much.
Thanks, Karina. Thanks for your presentation. In fact, I'm quite admired related or concerning the main reason why the innovation is more, it's not more visible in our days. The main reason is funding. In fact, I have some doubts if I agree, but I'm only the moderator. Okay, I think we have some time to address some questions from the audience. I will start with Ramon. We have a question in the chat in 10:17 from Monica Tata, and the question is, I would like to ask, how are they gaining the knowledge of the needs? It is through the surveillance capitalism, surveys, data collecting, private data collecting, using them to guide innovation. I think the main issue here is how you detect, or how you assure that the needs that you are addressing somehow are the real need, and the real needs. Is my interpretation of, or my soft interpretation of this question. Ramon, can you answer?
Okay, yes. From our experience, we are facing two kind of need. First of all, what I called unmet need. This is based on a bottom-up strategy, that it's the daily activity of physicians, of professionals at hospital social care, give us the possibility to identify these unmet needs and to try to reflect the degree to which there are existing solutions to this kind of needs. That exists an effective solution, feasible from point of technical and economical view, a feasible solution to the need. Some needs, some unmet needs are concerned with services, other with products, other with patient experience. So this idea of minors, what we call minors in hospitals, helping physicians, helping professionals for this activity of detection. In the first step of our model, we use this role of minors. Once it exists, this innovation culture in hospitals, at the end, all the hospital is acting as a gate for detecting this need, because it's like a virtuous cycle. This idea of, okay, we are improving daily our hospital or our center. Second kind of need is what I define as outcome-driven innovation or outcome-driven need. That is, in our healthcare systems, we are facing some problems. If we try to define or to rank these problems according importance and satisfaction, I think that it's clear to identify what kind of situations or what kind of problems are underserved in terms of kind of solutions that we are having, kind of solutions, or how or the outcomes that we are reaching with this new approach. We can identify this underserved area and the overserved area. In some areas, we are overserving the problems we detect. So trying to identify these underserved and overserved areas, we are focusing in the underserved areas. Why the solutions that we are having underserve the needs that we have in this area. So first kind of innovations are mainly detected in hospitals. Second kind of innovations are mainly detected through the policymakers and the payers, because are outcome-based and system and outcome system based.
Thank you, Roman. I think it's quite clear. I have a second question for Alexandre, and it's a question that you have in Q&A. Is innovation in health considering the raise of awareness and accountability from the patients towards the aggressive lobbying of pharmaceutical industry? I think you are the right person to reply that, because you have a double role somehow. Right now you have, of course, the experience in a provider, in a hospital, but you have also in the past you had a role in the payer and in the regulator. Then how you reply to that?
No, first of all, that there is some governance issues related to pharmaceutical industry. Namely on the pricing or transparency of pricing that had been that we have been raising awareness of it. Even though I don't think that innovation in healthcare can be resumed to pharma. Actually, even though the role of pharma is quite important on improving healthcare, and that's not under question, for me the issue is that how we are going to reinvent the healthcare system. And in that sense, pharma can play a role, but there are other innovations that are more relevant, and mostly in reducing waste of the healthcare system. So I really think that the breakthroughs are going to happen, and I tried to tell this within my presentation, but the major breakthroughs will happen when we will deal with the interfaces between providers, not only healthcare providers, but also social providers. In that sense, what we need to focus is in the way or in the model that we are providing care. And that pharma, it's only a piece of it. What I believe is that we need to refocus our efforts on innovation besides pharma. That, of course, it's highly a system that is quite based on multinationals and economic interests. I don't know if I answered your question.
I think yes. Yeah. Of course, is your view, and yes, it's the pharmaceutical. Of course, they have a role, but maybe it's not the main role. I think it's quite clear. Last question for Karina is a question from Sophia. We have this in, and the question is quite simple to put, but I think the reply or the answer could be quite tricky. And the thing is, the question is, how can citizens improve their health literacy? Because I can add a small thing to the question, that how the health literacy could have impacts in the empowerment and reduce the burden for the system, right? Because if you empower the citizens with some literacy, maybe the citizen will be will help the system to reduce the burden. But please, Karina, you are muted.
Okay, so maybe I need a twofold answer to that. One, to say that, and I will answer first to Sophia. It's not that easy for citizens to improve health literacy, because I do think that now it is very easy to have access to information, but that doesn't mean that it is the accurate information or and of course Dr. Google is not always the best help possible. And on the other side, because not all the information necessarily improves health literacy. So I do think this is, Sophia raised a nice question, because this is an area where we should have a lot of more support from a good health literacy strategy and policy from governments. I do think this is an investment we need to do. However, and this now goes to your part, I think that the main problem is that empowered citizens in terms of health literacy are very nasty patients. And I can talk that from myself. If I know a lot about my disease, I will ask a lot of questions. I probably will want to challenge the doctor with treatment, or at least try to understand why he's deciding for that treatment. And my appointment will take 1 hour, and the doctor will be mad at me. And at the end, it doesn't mean that this shouldn't be like this. But just to say that the principles we have in the system now are not prepared for people to know more about the things they are addressing. Because on one side, if you are more literate, of course, in some things you reduce the burden, because maybe you avoid to go to the doctor, or you can use another support like a phone line or an health app, and this would be okay. But when you go for the things that actually provide burden to the system and more complex diseases, I think that a literate patient is always a more time-consuming patient. At the end, I just think this was the way it was supposed to be. But I'm not sure if even our health professionals are already prepared for this at this point.
Nice perspective, in fact, because when I put the question, my thought it was more about in the prevention side. And somehow, if you have some health literacy, maybe you can have like the right actions and so, and to avoid to be sick. And but yes, your perspective is very interesting. Okay, I think we are running out of time, and thanks for your great interventions. I think we have time for one more question to hear the opinion of the audience, and we need to pass to the brokerage part. I think we have one more question here. Yes. The question is quite similar, but it's not the same. Who should be tomorrow the driver of the health value chain? We want to compare this.
You see, Karina is winning.
After all of this, no one has the courage to do something else.
No, I think it's quite in the
difference is that we are all patients. We are all citizens. I think that's the difference. So we can represent ourselves.
Okay, very good. Thanks again for your interventions, for your great interventions, and also thanks for the audience to put some interactivity in the process. We'll jump to the last part, to the brokerage events, where we have some.
Antonio.
Yes, please.
Can I suggest an idea like food for thought?
Of course. Please.
Yes, I'm sure that all of us, we can answer who should be tomorrow the main driver of the health value chain. I'm sure that most of us will agree with the answers, but I suggest some questions like a food for thought. First of all, can we imagine a hospital without beds? Can we imagine a hospital without patients? And finally, what will happen is that if the reimbursement scheme changed and was based on keeping people healthy?
Mm-hmm.
Just 3 questions, like food for thought.
Okay.
And then we can answer again, who should be the main driver of the health value chain?
It's true. Roman, thanks for your questions. I think we can use these questions to drive the second the second edition of this session, where we'll have more technology push approach. But yes, we would put that questions in the second in the second edition, and we'll see the differences.
Okay, thank you.
Thank you, Roman, for your share. Yes, I think we can pass to the brokerage part, where we have some not only entrepreneurs but people that represent organizations that want to share with us some potential opportunities. I remember that you have 2 minutes maximum each. In fact, we don't have more time. Then please be pragmatic. And we have the first one, Marta from Coimbra University. Marta, can you?
Hi, can you listen to me? Can you see me?
Very well. I'm not seeing you, but I'm. Let me check.
Why is that?
I can hear you very well, and you can proceed if you want.
I don't have the camera available.
Yeah, I think we can manage it. If you want to start, please, and in the way we will manage it.
Okay. So.
Marta, maybe it's from our side.
Yeah, I think it is because
yes. You can start and we will solve that in the way.
Sorry to interrupt.
Let me just check something here.
You are now promoted to panelist, so you can share your screen and sorry, you can share your webcam now. You can turn on the webcam.
I think she left.
Yeah, I think Marta left.
Maybe you can pass to the second one and come back to Marta later.
Sure.
Next one is Sergio Gravina, that is innovation manager in Italy. Please.
I think Saverio is not here at the moment in our list of attendees.
Okay, next one then. Okay, we have the next one from Ash Correa. Do you have someone representing this organization?
Hi, I'm here. Hi.
Okay.
Are you listening?
I can.
Oh.
We can.
Oh, okay.
Listen, yes.
So, hi everyone, and thank you for the opportunity to introduce myself. I am an English to Portuguese translator and language consultant, specialized in the life sciences and medical pharmaceutical content. So I translate clinical trial documentation such as protocols and subject-facing materials, like informed consent forms. I also perform the translation and adaptation of critical outcome assessments like patient report outcomes and quality of life questionnaires in a process called linguistic validation. So right now I'm looking for medical and life sciences companies and clinical research organizations or associates who need to translate their content into Portuguese. So we can work together to ensure regulatory compliance and improve communication with healthcare professionals, patients, caregivers, as well as the general population.
Very well. Thank you for your pitch and Yeah, I think it was possible to understand what you do. Next one, Mario Garcia, that was an active member in our question and answers, and thanks for that. Mario, please.
Hello?
Yes, we are hearing you.
Good.
Yes.
Okay. Good morning to all. First of all, congratulations for the nice broadcast that you are doing today. I would like to share that I'm an executive for more than 15 years of leadership in business, in management, in the healthcare sector. So in the last 5 years, I led a multinational company in Iberia. And now I'm doing consultancy in projects for the healthcare sector, mainly in the private sector. I'm searching for partnerships and probably investment in some startups in the healthcare sector, mainly in the radiology field. Thank you very much to all.
Thank you, Mario, for your short intervention, but quite clear. Thank you.
We will now return to Marta.
Marta, good.
Okay.
Hi, everyone. Sorry about the call. So thank you for letting me present a little bit of the university. So I am from the University of Coimbra. I am also a science manager at the university. I think we are a very important and interesting partner for R&D, the research and development activities. And we are always looking for partners, either for pharmaceutical companies, biotech companies, or to develop medical devices, work in digital health projects. So I think because the university, their main field of research is somehow health. We have the 38 research centers. Most of them are somehow devoted to research in health. So we can develop. We have a lot of projects from ICT to social sciences to neurosciences, a lot of research in aging, from molecular mechanisms to the development of assisted living technologies. So we have our main activities, of course, the research. So I think we are a great partner for European projects, national projects. Antonio.
Thank you, Marta. Thank you for your intervention.
Thank you.
Okay, the next one. We need to jump
the last
some.
one.
Okay, only to share with you that next week we'll have the second week of the event. We have a tech panel on Monday. And on Wednesday and Friday, we'll have also these parallel sessions, and precisely on Friday we'll have the second session on Wednesday we'll have the second session of this part related with health, more focus in the first part of the value chain. If you remember well, this session will more focus in the last part of the value chain. The second one will be more focused in the first part. That's why we'll have an entrepreneur that in fact is producing a new device, and this being supported by Diatomic Digital Innovation Hub. We'll have Philips that will talk about the tension between to be sustainable and profit, or to be profitable, but somehow maintain the sustainability of the system. Then it's quite tiny border. And last, we'll have an intervention from Karolinska Institute that will show us some problems or challenges when we try to put innovation in hospitals. Then the idea is you are invited to assist, of course, and we will try somehow to brief or to use the information collected in today to brief the next session. Then thanks to all, and we see you in the next week. Thank you.